Next, we are proud to present Natalie Shayen-Smith and Rima Dirks. Farm D, come on out here, beautiful ones. And did you know that Black Americans are 5 times more likely to be diagnosed for asthma, but underrepresented in clinical trials? So we are pleased to have Natalie Shayen-Smith, who is an associate for representation for clinical research at Amgen Incorporated and a health educator for Rivkin Center, along with Rima Dirks, who also has a doctorate in pharmacology degree and is a senior medical science liaison from Amgen Incorporated as well.
Hi, everyone. I'm going to be talking about diversity and representation in clinical research and clinical trials today, which is excitingly a topic that has come up a few times. It's really, really important. And then later on, I'll pass it off to Rima to talk about health disparities in asthma, how you can be your own advocate. Thanks. How you can be your own advocate and how we might try to start mitigating those health disparities. So first of all, getting into my topic with clinical research, I first want to level set with everyone and make sure we all know and understand why having representation in clinical research is so important. So first of all, for those of you who do not know, I'm sure a lot of you do, but clinical trials are very important for us to find out and know about medications and whether they're safe, whether they're effective to use and to be diagnosed for people. And the people who participate in those clinical trials make vital contributions for us to understand how those drugs are responded to. So the concern comes when we don't have representation in clinical research. If people of minority groups are not represented in those trials, then how are we supposed to know how they're going to react to those medicines, right? Your doctor is just going to assume that, you know, the way that the people in the trials responded is how you're going to respond, but that isn't necessarily the case. So what we need to understand is that we need to take into consideration not only racial and ethnic contributions, but also knowing that there's a lot of factors that go into the way you're going to respond to medicines, which also includes social determinants of health, which is a term some of you may know, which is like your diet, your exercise, like we were doing today with the guru of abs, your environment, your lifestyle in general, which are sometimes things we refer to as things in your control. They're not always in your control, but things that are more so in your control, right? And then the other thing is your genetics, which, sorry, but you're born with those, not in your control. But those do affect the way you respond to drugs. So ultimately, if we can have more representation, we can have a better understanding of how everyone's responding to them, and we can get closer to health equity. So at Amgen, I get to be a part of an incredible team called the RISE team, or Representation and Clinical Research team. Shout out to a lot of my teammates that are over there in the blue t-shirts. If you have any questions, you can come to me, but they're probably more of the experts anyway, so you can go to them as well. But on this team, we actually are focused on increasing representation and proportionate representation in Amgen's clinical trials. And we do that by focusing on groups that have historically been excluded from trials. So minority groups and, and underserved populations. So we have different objectives that help drive us. And one of those is that we want to exceed industry benchmarks. So we want to make a new standard of what good looks like in this, right? We want to make sure that everyone is included and to continue to improve that inclusion. And then lastly, we want to collaborate and scale. So we want to collaborate not only with our internal partners at Amgen, but we also want to be collaborating with external partners like Black Health Matters. That's why we're here right now. And we want to continue to learn about how we can be better. We don't just want to say, oh, you know, what we're doing is working right now and then be comfortable with that. We want to continue to grow and improve on our mission. So going to the next slide, a little bit more about my team. Our objectives are driven by 6 pillars. And so first of all, we want to evolve the way that we run and design clinical trials. And like I said, we want to focus on people that have historically been excluded to make sure that they understand that their contributions are extremely, extremely important to make science better, you know, to put it in simple terms. We also want to change how researchers are communicating with patients, caregivers, and providers there has to be a better communication. There has to be mutual respect, and ultimately that will help better the way that trials are run. We also want to partner with clinical trial investigators who themselves are representative. This is something we also talked about today. We need doctors who are themselves, Black and Hispanic and Native American and Asian and whatever it may be. We need them to be represented in the trial so that when you go, you see someone who looks like you, who knows your culture, who understands you, who makes you feel comfortable. We also want to enhance precision medicine and translational science to make medicine ultimately more catered to you as an individual. We also want to bring research directly to the communities and partner with community organizations on a national level. So that's, again, why we're here today, why we went to Harlem a few months ago, and why we're here in LA and continue to be at these events and interact with the community. So to highlight some of our recent achievements on the RISE team at Amgen. So we recently committed $8 million to the Robert A. Wynn clinical trial program. And so this program is meant to be pretty, to bring funding to find diverse doctors and medical students and bring them into community research. So giving them the opportunity to really, not only help the community, but themselves also make it normal to have more minority groups in research. We also launched Amgen's African American study, which is the first of its kind study where we're collaborating with the Black cardiologists and Morehouse School of Medicine. And so this study is meant to enroll 5,000 African Americans to determine the association between lipoprotein (a), which is a biomarker, and cardiovascular disease. So this is ultimately supposed to not only help us understand more about why African Americans are disproportionately affected by cardiovascular disease, but also disease in general, because those disparities should not exist. We also participate in numerous sponsorships where you can actually see on the next slide, including Black Health Matters and many others, and we hope to only continue to grow this portfolio. So thank you all so much for listening. I'm going to pass it off to Rima to speak about asthma.
Thank you, Natalie, for that. My name is Rima Dirks. I'm a pharmacist, and I'm here to talk to you about asthma. First of all, thank you to my employer, Amgen, and Black Health Matters for letting us take the stage today. And I really want to give a big shout out to you all for being here to further your education and to really be the best advocate you can be for yourself. So today we're going to be building upon the previous conversation that you saw with Audra and Dr. Hawkins. And my goal today really is to help you learn to understand and manage your asthma so that you can have a really helpful and productive conversation with your healthcare provider. That's why I wasn't. Thank you. That's perfect. So, thank you. As we heard many times today, it's really up to you to be your most powerful advocate for yourself as well as your loved ones. Can I get the slides up, please? And 2 slides in advance. Yes. Okay, so this is my second year here presenting at Black Health Matters LA. Feel very privileged to be here. And actually, we're the second speaker on asthma today. It is that important. And I think you know why. How many of you in the audience have someone that you know who has asthma? Raise your hand. So many of you, right? And according to the Allergy and Asthma Foundation of America, if you are Black and have asthma, you are 5 times more likely to be admitted to the hospital compared to your white counterparts, 3 times more likely to die from asthma, with Black women having the highest rates of death due to asthma. You're also 6 times more likely to visit the ER due to your asthma. Now, my point is to not scare you, but really to help you understand that this is a disease that so many people die from every single year that don't need to die. And I want you to hear me very clearly on this. Nobody should be dying from asthma in this day and age. Next slide, please. So we could spend a lot of time talking about the cause of these statistics. The reasons are really complex, right? Social, structural, biological determinants are all responsible. Things that are under your control, however, are things like tobacco and education, which you are doing here today, but many others are not. As a proud Oakland resident, I see signs of this in my community. Hey, there we go. And really how it's affecting my neighbors and my community every day. And I've talked to many of you today who shared with me very graciously your asthma stories. And you've told me that sometimes your clinicians don't actually want to diagnose you with asthma, and telling you to lose weight or exercise more, and being dismissed, as you all know far too well, is a real thing. And I hope I can give you some tools today to help you with that conversation with your doctor. So that's why we're here, to really take back that power, to take charge of your asthma and be as bold as you can be when it comes to your health. So next slide, please. So education really is one of those pieces on how we can bridge that gap in asthma disparities, and it's a very big part of that. So you're already taking that first step. The other comes from policies, research, and partnerships we have with the community, like the one at Black Health Matters today. Next slide, please. So let's get into it. Next slide. So we're going to learn that asthma is a chronic disease of airway inflammation. Next slide, please. So asthma is a chronic disease, which means it lasts a really long time and can be lifelong, and it affects the airways of your lungs. So here we're looking at 3 different airways. The airway on the left belongs to a person who does not have asthma. And you can see the airways are nice and open. Those dark pink muscles around the airways are nice and loose, letting air in and out. And even if there are asthma triggers around, you can see kind of up there on the left in the green bubbles, pollen, smoke, dust, the airway is not affected. The one in the middle belongs to a person with asthma. So you can see the airways inflamed, the irritants cause the muscles around the airway to kind of tighten up, and the mucus starts building and making it kind of harder to breathe. The airway on the far right is when someone's having an asthma attack, or as we call an exacerbation. So the muscles around the airway are tight, there's lots of mucus, there's hardly any space for the air to flow in and out. And if you've ever had an asthma attack, or you know someone who's had an asthma attack and they describe it to you and they always say it's like breathing through a straw. And that's a great description of how incredibly scary it is to have an asthma attack. Next slide, please. So when the airways become tight and narrow, it can lead to some of the symptoms that you see here: the coughing, chest tightness, shortness of breath, and wheezing. And you may have a few or all of these symptoms. It's really individual. Next slide. So your doctor's going to diagnose your asthma. Next slide, please. The doctor's going to diagnose your asthma by looking at the symptoms you have, your medical history, a physical exam. They might do some blood tests or make you breathe through a tube with a pulmonary function test. Next slide. So severe asthma and uncontrolled asthma are 2 types of asthma. The third is severe and uncontrolled. And I think that one of the most important things that you can take away from this today is on the far right of the slide. So these are the indicators of severe and uncontrolled asthma. So if you have your notebooks and you're taking notes, this is something good to write down. So if you have asthma symptoms more than twice a week, if you're using your puffer, it looks like this, your inhaler, your rescue inhaler, more than twice a week. If you wake up at night, or your partner tells you that you're waking up at night coughing or having trouble breathing twice a month or more. If you're refilling your rescue inhaler more than twice a year, you need to tell your doctor. These are the rules of 2. Write it down, and we'll talk about how to do that in a few minutes, but you need to tell your doctor at the next appointment. Next slide. So you're not alone. Asthma affects 25 million people in the US. Next. 2.5 million people have severe asthma. And next, please. And about half of those people with severe asthma are uncontrolled and still suffering. And you saw the statistics that I showed you earlier, so I don't need to tell you what that means for the Black community. So the immune system is an underlying cause of your asthma. And next slide, please. So you heard Dr. Hawkins talk about triggers today. So all of these things in the circle that you see are triggers. And you've got laughing, crying, stress, so heightened emotional state, exercise, weather, climate, bacteria, allergens, and pollution. People are often surprised when they see laughing, crying, stress on there, but ask anyone that you know who's seen a funny movie, they have asthma, and they wind up having symptoms after. Some of these are geographical. For example, we live in California. Things are blooming year round here. We have the special additional season called wildfire season that affects people greatly with asthma. You might take a trip to the snow and you get out of the car and you take that first deep breath of cold air, and that could trigger your asthma as well. So the take home message again is to write things down that affect you. Just like Dr. Cutter talked about earlier, keeping a notebook with all of your doctor's appointments, keep your symptoms in there too. Next slide. So the immune system in people with asthma is super, super reactive and will over respond to whatever trigger you have. So if your trigger is cigarette smoke and you and your friend who has asthma go out on a walk, you walk through that same smoke, that may not affect you as someone without asthma, but your friend with asthma will see this really large exaggerated response from their immune system. Next slide. So in asthma, when you inhale something, your trigger, that can be pollen, pollutants, viruses, that trigger interacts with the surface of your lung there in the pink, all those cells. And this trigger kind of turns on or activates a whole bunch of other cells that cause your symptoms, coughing, wheezing, all those things that we saw earlier, which can lead to an asthma attack. Next slide, and we can just skip that one. So you're going to manage the role you play in your asthma care. So what can you really do to take charge of your asthma? So it's really a combination of these three things. So lifestyle changes, medication, asthma journal, and you can discuss these with your doctor to really come up with a plan. So next slide. So the first part, lifestyle changes. Next slide, please. There are a lot of things you can do in your home. It's a big laundry list of things when it comes to lifestyle changes. So I know we're going to be short on time, so come see me at my booth over there and we can get some more resources and talk further. But if there's one thing on this list that I can leave you with, and I know many of your eyes are probably drawn to the same one, stop smoking. If you're smoking right now, the best thing you can do for your heart health, for your lung health, is to stop smoking. And I can provide you with some resources for that too. Next slide, please. So asthma journal. This to me is so important. And we've heard it from several speakers today. So tracking your asthma in a little notebook, on your phone, if you have a printed calendar, write down the date, your asthma symptoms, if you had to use your rescue inhaler that day, any information that you have, you can share with your doctor. Write down if you went and you saw your friend who has a cat, and then immediately you started wheezing and your eyes started itching. All of that is important. If you had to miss work or school, family activities because of your symptoms, that's important too. And remember, we talked about the rules of two. One of them is nighttime waking. So if you're waking up in the middle of the night more than twice a month, make sure you write that down and share that with your provider. Next slide, please. And lastly, medicine. So if you have asthma, you are probably going to need to take some medicine in pill form, inhalers, injectables. Some rescue inhalers, like the one I've been showing you, are there to rescue you from an asthma attack. And hopefully you won't have to use that every day. If you are, you need to write that down in your notebook. Some inhalers are the ones you use every day, just like brushing your teeth to prevent cavities. You use those inhalers every day to prevent an asthma attack. So each treatment is really unique to you. And I know I keep talking about the asthma diary or a little notebook, whatever you want to call that, but please provide that to your doctor or your healthcare provider to begin that discussion on how to best treat your asthma. Next slide. So here are a couple more asthma resources: American Lung Association, the Allergy and Asthma Foundation network. And we've got some great partners. Leonis is out there in the audience. Find her, she's amazing. And we also have some brochures and some resources at the booth. Next slide, please. So if you've heard of a steroid pill pack to help control inflammation after you've had an asthma attack, it's necessary. But sometimes it's a Band-Aid on the problem. It means your asthma is not well controlled. And there are side effects, just like with any medication, with those medications, if you keep taking them over and over again. So writing down each time that you've had these You may have different doctors. You may have gone to the ER who you might be in a different city. Just make sure you write those down in your notebook so your doctor can get a better picture of the root cause of your asthma. Next slide. So always remember, you should always seek care immediately when you have an asthma attack. I understand it can be very scary, but we don't want you to lose your life because you're scared to go to the doctor. Have a plan in place for you or your loved ones with asthma. Last slide. I want to remind you that you do have power over your asthma. It doesn't have to control you. I know we've gone over a lot in a short period of time, so we can take some questions. Again, please come see me at the booth if you want to talk through some of this a little bit more. I can provide some resources, how you can take back that power and really, as Rosalind said at the beginning of the day, how you can be the CEO of your own health. And the next slide. Thank you. There's some additional resources. Appreciate it. Thank you.